Welcome back to another episode with ByrdAdatto. Throughout this week, we are talking about ways to get your medical practice prepared to reopen. As we've mentioned before, a lot of our states are open, even partially, and some of you are preparing to get open. But before you open your doors, there's a lot of things you should consider, and we're going to break it out into different segments. And today we have a special guest who we wanted to bring in because there's a consideration of safety that has at least your team, and what are the things you need to consider. And Michael, please introduce our awesome new guest.
Christie Hutchinson, she is our friend. She is our valued bridge between developing something legal and also compliant from a standard of care medical OSHA perspective. Christie's an RN and an MBA and has just been a great resource for our clients and other providers out there in putting together protocols and other office-related policies and procedures that promote patient safety.
Welcome, Christy.
Thanks for having me, guys. I appreciate it.
Yeah. Well, as we're going through all these different things to consider, obviously protecting your staff should be something that every practice should always be considering. But obviously, during a pandemic, as you reopen the doors, especially for groups who have been closed because of rules requiring them or have had partial staffing, again, because of the need to not provide elective medicine, can you start talking about certain things that they need to be considering? And obviously, I think, as you probably will say, a lot of these they should have done anyway, but it's a good refresher for everyone.
Yeah, absolutely. Right now, the CDC is recommending that medical providers and medical healthcare workers treat all of their patients with universal precautions. So that means the assumption that everybody has COVID. And so, masks and gloves are very important. Certainly, if you want to have other PPE in your facility, such as goggles or face shields or gowns, depending upon the procedures that you're offering, those are all appropriate. However, don't have things if you haven't educated your staff on them. So if you are going to bring in new PPE, please educate your staff on the proper donning and doffing of them. Did a webinar earlier today for AmSpa and had a link on there for the CDC website that has some PDF pictorials of how to don and doff your PPE. So it's a great resource that you can go and print those off, put them up in your break room, or provide those for staff to educate them. And of course, hand hygiene right now, super important. And as an employer, OSHA says that you are responsible for your staff, using proper hand hygiene. So when do I need to wash my hands? When can I use hand sanitizer versus using soap and water? How long do I need to wash for? All of these are very important, and you can find a simple Google search for WHO, the World Health Organization, or CDC. You can find little graphics for proper hand washing, proper hand hygiene that you can, again, provide to the staff. So make sure that you're educating and training them properly.
That's awesome. And Michael, what are your thoughts?
Right now, just from a human perspective, we're all experiencing something that is unusual. And if there's ever a time where you have people that are maybe even, not that risk averse who are scared. And so this is a time where we're kind of taking new ground. And so these precautions are not only required, but they're a great way to give some sense of security to your staff. And then the second thing, I think, Brad, you've talked about this, is that there are record numbers of OSHA complaints that have happened from employees over the last 6 to 7 weeks or whatever that time frame is, and so it's from our perspective, there's a real business risk with doing things the right way to protect your business.
You bring up a great point. One of the things that we're really encouraging everybody to do right now is to have a robust cleaning and disinfecting policy. So not only does it say where and when you're going to clean, but how do you clean things? And so if you're running around using household products, probably not compliant. And you do risk your employees making complaints on that. So, making sure you're using your typical hospital grade, medical grade disinfectants, making sure that you're following the wet time that it has on the canister or the spray, making sure that you're educating your staff on, we're not just wiping down the bed anymore. We're now doing counter and tablets and the doorknobs and the light switches and anything that somebody might be touching. There's other things to consider, such as, do you want to allow visitors to come in with your patients? All of these are different techniques and strategies that you can use to help protect your staff. The other day we were talking about, do you want to limit the scope of service of what you're offering? So if you have a procedure that maybe deals more around the mouth, you'd have to ask the patient to take their mask off. Well, maybe people aren't comfortable with taking the mask off right now. So maybe we'll limit the treatments that we're offering until everybody gets a little bit more comfortable, or until we see this COVID surge calm down.
And I think the most important thing, especially with your team, it starts with, obviously, the medical providers, but every single team member needs to feel safe, because it's going to make them all feel safe, so that when the patient does call and want to come back in, they're going to be communicating. So, oh yeah, this is great. It's super safe to come back. We're wearing this great PPE. We're doing all this cleanliness. We're doing everything that we can do, because if the staff doesn't feel that way, it's going to come through the phone calls. It's going to eventually get out. And obviously, more importantly, besides protecting yourself, protecting your staff is important. And as Michael had mentioned, a ton of OSHA complaints. That's what you're trying to prevent your staff from getting sick. That then shuts you down again because you did something wrong that you should have done to protect yourself. But unless there's anything else, I think this is great. Thank you again for joining us.
Absolutely. I appreciate you guys having me.
Thank you, Christie.
And for those, for the rest of the week, like I said, we'll be talking about different segments throughout this week, making sure that you have the information you need to get yourself prepared to reopen. Thanks again for joining us.